his urges. That sounds like I hope authorities are involved. Are you sure you have this whole story though, Kenneth? Like this is just sounding like.
Also interviewed a young kid because they were wondering because the parents allowed them to do it.
And it's for well, how is he dancing?
Like in a club, like a runway dancing type thing.
Maybe you could provide me with the article. Because like someone who's a ballerina, it's so like I think like how sexualized the dancing is a big question. Like what kind of club is this is a big question. But if the men who are watching this are sexually attracted to this child.
I think the gentleman from we found some article on.
Yeah,
he's 11.
This is 11-year-old drag kid dances in popular New York City gay club as patrons toss some money at.
Wow. Well, I am not CPS. And I am not the authority on, where is the line of childhood abuse.
The moral of my question was, is that technically considered an act of
well, I would say if they have those sexual urges, are fantasizing about this child sexually, okay, want to have sex with this child, know that he is prepubescent, and act on those urges in any way, as far as all the ones that I've mentioned, masturbation, looking at pictures of him, watching and masturbating or getting off in some way, then yes. So if it meets the criteria, then yes. As far as the parents are concerned, like obviously it's a news report, so you would think that if there was need for a child protective agency, they would have moved in. I guess they have deemed that whatever it is the child is safe. So, yeah.
Sorry, I was just curious.
Yeah, that's an interesting question. That's for sure. I definitely have not heard that one. Definitely sounds questionable, and I would be concerned as someone who is so young. Not, not the drag dressing, by 10 or 11. That's not the concern that I have. By that time, like I've mentioned in here before, developmentally children understand their both gender and a lot of their sexuality, not all of their sexuality, but a lot of it. And so with that, if the child, felt more comfortable dressing as a woman, that's, we've already talked about how gender dysmorphia or that fits in. That's not, the abuse, I would say. The abuse would be putting your child in a position that they could be, abused in some way. That makes sense? I just wanted to clarify that.
Curious because like we were talking about it when the interviews of the men that were watching, they said, "No, I am not a pedophile. I don't do nothing." But listen, you discuss, they kind of, in my eyes, is acting in.
Well, I mean, I guess it's possible, like just like you can watch, ballet or jazz or art, and not be sexually attracted to the children who are at the recital. I wouldn't say that all of those men are liars. I wouldn't say that.
No, sorry.
What?
I apologize for bringing
you don't have to apologize. I just wanted to clarify that I didn't want to stigmatize the trans community and I really do believe that they may not be pedophiles. Like they may not be sexually attracted. They may, be just like this is a form of art and, expression, and they're not attracted. That could, and they have no, urges or acting on it. That could be possible. I would say that.
So they don't need to act on it for a diagnosis?
No, they do need to act on it for a diagnosis. I'm just trying to say that those people who were interviewed.
Oh, on the slide it says they don't.
Really?
Yeah, it says acne urge is not a requirement for diagnosis if the urges cause person distress.
If the urges cause person distress.
Okay.
That's a big point, though. If the urges cause person distress. So okay. I need to back up and not go so fast on this. Okay, so adult has recurrent intense sexual urges or fantasies about sexual activity with prepubescent child, okay? Most of those people are going to likely act on it eventually, meeting criteria. But here, this is the big one. Acting on urge is not a requirement if the urges cause person distress, because that's kind of the overarching need for all disorders, is that there needs to be some distress.
Okay,
Does that make sense? I'm sorry, I did not clarify that well enough, but I'm really glad you asked, because I'm sure other people were also not looking at that second half. Yeah. Okay. Yes, Amanda.
Well, now I'm confused.
Mhm.
So does that mean, like, you said, like, people thinking about it? So would that be like urges that cause someone distress?
I mean, some people are very distressed by it,
Okay.
which is good, but some people are not.
Okay.
I can read it again and try to just say it again more clearly. So, first part of the criteria is they have these recurrent intense sexual urges or fantasies, okay? The second part is acting on the urges are not a requirement if the urges cause a person distress. So, only for those who are not in distress do we see that we need action. But acting on the urges are not a requirement if they are also in distress, because you can't have action and distress. Well, you can have action and distress, but probably not likely. Very not likely, I would say. And that's just extra and meeting the criteria. Yeah. You feel? So not all people who are pedophiles act on it. A lot do, but not all. And then if they are not one of the actors, they have to also have distress. They have to have significant distress about the urges that they have. Did I say that one more clearly that time? Okay.
So you're saying it's because I think it'll be confusing for people who first hear this. Like, it's possible to be a pedophile but not have the disorder.
Right. Well, no.
Really?
Well,
Because,
yeah, that's true. Because, I wouldn't call him a pedophile then. You can have these thoughts, okay? I don't think this human exists. You can have these thoughts and not be disturbed by them and never act on them, and then you do not meet criteria. Would that person exist in the real world? I would be surprised, because I would say they probably didn't meet this criteria, that those sexual urges were not very intense for them. That's what I would say would happen in the real world. That it would be maybe OCD, that they have some fleeting thoughts, but even then they would probably find it disturbing. It would just be a very fleeting thought that just happened once, and then they were grossed out about it, but not very distressed about it, and then they moved on and it didn't happen recurringly. It's intense that the person would be drawn to act on it. Yeah. You feel me? Yes, Ruth.
What about people that are not attracted to prepubescent children, but pubescent children?
How old?
There's no diagnosis for that?
For 15, 16 years old? Yeah, I mean, they also, look a little older, and they, still illegal. It's definitely still illegal because they're not 18, but that's not as pathologized, because a lot of times they look like adults. And then, you know, the person is able to be like, oh, they're a child, I can't do that. But boy, do they look like that 21-year-old girl too, you know? So there's
But
a
the people
different
that
there.
Don't have that thought, that they know they're that age and they still try to go after
The ones who are like 15, 16, that's not a pedophile then. It's not a pedophile then. Yeah. I mean, it's just not as pathologized, again, because they look like an adult. Like their body looks like an adult. And they also have more agency because they're older and they developmentally, hopefully, they would be able to, you would, you know, oftentimes it doesn't happen, but like if they were being, you know, abused, or it would be more likely, as you get older, it's more likely for you to report. So it'd be more likely for them to say, you know, this isn't what I want. Also, with someone who's not prepubescent, who is, you know, has sexually matured in some way, they may also be interested, which is a very big difference, I think, also in the, you know, a 16-year-old is definitely, 15-year-old is definitely unsafe and not like healthy for them to be with someone who is older than they are sexually. You know, that there's huge risk factors and can lead to really, you know, poor outcomes. But it's not being a pedophile according to DSM. Can they be charged? 100%. Like, can they go to jail? Most definitely. Like, it's very illegal.
But in that case, they wouldn't offer them like some sort of therapy.
Oh, for sure not. For sure not. For someone who's like with a 17-year-old, 16-year-old, they're just going to jail. Yeah, Cyrus.
And also come down to the societal use of pedophile. It's like a lot of people like slap somebody who like dates a 17, 16-year-old as a pedophile, but like definition wise, isn't it like applied to children?
Mm-hmm. Yep.
So I guess that's why that kind of thought might come up.
Yeah, for sure. Definitely. Definitely. Yeah. Yeah, I mean, it's not to say that that's like one is better. I mean, I will say actually one is better than the other, you know, like being a 20-year-old boy with a 17-year-old girl is not as bad as being a 20-year-old boy with a 9-year-old girl. There's just a difference. And in the eyes of the law, I think also, I mean, I'm not familiar exactly with like the, like cutoffs and jail time and how they decide that. But I would take a leap and say you probably are going to be worse off if you do that to a 9-year-old than a 17-year-old as far as jail time and probation is concerned.
There's a lot more laws that can situation.
The ones who are post-pubescent, is there? That's interesting. Okay, hold on. I have to catch up on all of these people. I haven't. Ruth. Okay, hold on. Amanda, Caroline, Cyrus, Sebastian, I think. Okay. If I missed you, let me know on this. Okay. Any other questions? Let's move on, though. I would like to move on so we can try to get to. All right, rape. This also is not found in the DSM. As you know, you are a rapist. That's not one of the diagnoses. But it is, you know, important to note, as many people who unfortunately have experienced rape will be coming to your office for any number of psychological disorders. So it is sexual activity involving actual or threatened forcible coercion of one person by another. Statutory rape is sexual activity with person under the age of consent, and then sexual assault refers to the other forms of unwanted sexual contact. So maybe statutory rape is like what you were thinking of, Ruth, but not pedophilia. Yeah. So here we just have some stats on the U.S. Department of Justice outlines some of the statistics about women who were raped from 2005 to 2010. Rape per 1,000 females ages 12 or older. So here we have per 1,000, we're at a little over 4. a little under 4. So clearly this is the most dangerous age. And then 65 is quite low. Yeah. But you know what, actually, sexual assault's going up for individuals who are in nursing homes. So that's really sad. But different than rape. What?
Especially in New Mexico too.
Especially in New Mexico? Why New Mexico?
It's a lot of, in like, there's a lot of more like retirement communities, like in the warmer population.
Oh,
But
so like
then
New
it ends up being
Mexico,
a lot of, like,
Florida, California.
But then it ends up being like a lot of like sex trafficking in a sense, because then they're not, also like the adults, like the elderly aren't as like coherent anymore.
So 65 plus year olds are being sex trafficked?
Yeah, exactly, it's like a legit.
Whoa.
They probably have no idea though.
No, they don't.
Because they're just like.
Like they have Alzheimer's.
Yeah.
and dementia? Gosh, this is why I don't watch the news. That's terrible. I did not know that. Okay, well, this is the stats from 2005, 2010, based on a study from 2013. Okay, so depending on the definition used, prevalence figures for rape in the general population, obviously mostly of women, are between 5% to 13%. But what we do see is that the definition does vary depending on the study, depending on the researchers. They may not include like what we did as far as the threatened part. A lot of studies do not include that in those statistics, so that's why you see such a range. Also, the type of information gathering is going to range, and then also the number of rapes that are not reported are incredibly high. So there are some statistics that estimate that, and there are some statistics that just don't include it. Also, why you see such a range. Yeah.
What was the percentage?
5% to 13%.
What's for lifetime?
Just in the general population. So you can look as far as like, did this happen to individuals once in their lifetime? Yeah. And then both Alyssa's spoke. Janet spoke. John spoke. Okay, sorry, I was a little behind on my ticks. All right. Again, highest in women and then most high under the age of 34, as you just saw in that previous slide. And then also what we do know is that, that scary image, I think that really we've kind of like washed that away from our understanding about what rape is, of like a man who's like jumping out from behind a dumpster at night. Just that happens, incredibly rarely. Usually it's an acquaintance at a party, someone that you know, a family member, a friend, a mom's boyfriend, that's like really high, or a step sibling or stepfather or something like that. That's usually those who are being who are doing the raping. What's that word? Who are the rapists, I guess. Okay, is rape motivated by sex or aggression? Have y'all heard of this? Aggression. We talked about this yesterday. Cheater. Anyone else want to add on to it, maybe? We talked about a lot of this part in my class yesterday. So we do know that it is motivated by aggression. It's not about sex. It's not about someone who just has like a really high sex drive. That's not it at all. What we see it as is more of an act of violence and an act of intimidation and purposely asserting your power over another person. It's not necessarily even a pleasurable experience for the rapist, in that, it doesn't usually go down and that it would be as pleasurable. But what's pleasurable for the person, like physically pleasurable, but what's more pleasurable for that person is being able to be so aggressive towards another person or asserting so much power over another person, is what's the pleasurable part. What we do see also is that rape victims, as I mentioned, are mostly females, but the degrees of attractiveness the age distribution, the location of the rape, the clothing that the individual is wearing, like all of those, socioeconomic status, education level, all of those things like vary completely, like very, very widely. That there is, a lot I think of the asking for it dialogue in today's culture, and what we see in the research is that there's no correlation to that like the person could be in like the ugliest puffer coat, could be someone who's like very physically unattractive, could, be the opposite, I guess, of what the societal image of what we have as someone who's a rape victim would be, and there's no difference as far as the likelihood of being victimized in this way. What we also have found from the research when asked rapists as far as what is their motivation and the reason why they did it, what they note is that it was more just an urge and an action, and that there wasn't, anything that they were particularly attracted to about that woman or anything like that. It was more of an urge to be aggressive and an urge to act in such a way. Yes. Any questions on that one? Okay, so what we see as far as rape and the potential consequences, as I mentioned, incest is definitely the worst. But obviously with incest, most likely the person is being raped. That the person who is being a victim of incest is not consenting, and it's usually a child or someone who is not of the age to be consenting or ability to be consenting. But with rape, we also do see like incredibly poor, I don't want to say incredibly poor outcomes, but incredibly painful outcomes, I guess I would say, as that it's the next most is psychologically traumatizing, even though it's still within the same like umbrella. So there's the physical trauma, that it's physically painful to the body. There's the psychological trauma, as I mentioned, similarly to the discussion about incest, and that it often changes the worldview of the individual, that the world is no longer safe, that they may be seeing themselves as worthless, as, someone who's unworthy of love or appreciation or respect. We see, very high comorbidity rates of depression, anxiety, PTSD, because of this incident, whether it happens, once to this individual, and then obviously even more so the risk factors will go up for having these psychological outcomes of if it occurs, if there's a reoccurrence. A lot of times with the reoccurrence, it's probably happening with like a boyfriend, a husband, a family member, that someone has like continuous access to the victim, that you would have reoccurrence. And then with that, the risk for all of these outcomes will just increase with every incident. Again, PTSD is probably the most highly linked to being a victim of rape. So can you fill in the blanks? Anyone want to try? No one wants to try? Why don't I have that?
Maybe the first one.
Okay.
Family. Family might commit small fraction. Within the family. No.
So women.
Women is true. Women is definitely true. But what I wanted Joel to say is strangers. Oh, sorry, Sebastian, you were going to say that? I apologize, I said it first. Women is true. Family, unfortunately, isn't true. And strangers is what I wanted you to say. Okay, most rapes are committed by.
There's that.
Okay, yeah, a lot of them are, not most, but you're like on the right track. Someone they know, yes, a person who is known. Like maybe think more broadly of these. Okay, 60% of all rapists are under blank years of age. This I haven't mentioned yet in lecture. It's not under 18, but it is a low number.
30.
25, who said 25? Great, okay, so many people participated. I need to get all these names. Tyler participated. Yes, okay. Okay, wait, hold on. I'm sorry, will you tell me your name again? Damien, I apologize. Okay. Who else participated? All the others, Taylor participated. Okay. Great job, y'all. I already got, oh wait, no, I don't. Okay. No, I did. Okay. All right, so now let's look at the treatment. And unfortunately, the high recidivism of individuals who are sex offenders. So, as you mentioned, as I mentioned already, for individuals who experience sexual abuse as a child, they are more likely to become sex offenders later on in life. And what we see is that there's very high rates of recidivism. So if you are someone who sexually offends once, it's quite likely, if you do not seek treatment or get treatment or are given treatment, that you are a person who will offend again. Sorry?
I was like, I just don't understand that, because it's like, why would you,
I know, it's.
I just think about like how
something.
that would affect you, like negatively. Why would you wanna cause that harm to somebody else?
Yeah.
I know. And there are thankfully some people who do feel that way and are able to make that logical connection.
Yeah.
And those are the people who are probably going to therapy. And, you know, I even had one person say to me who I was seeing, and that she knew these rates and knew that this was likely.
Yeah.
And she even mentioned to me, like, it's something that I'm scared about. So even someone who experienced sexual assault as a child, knew how painful it was to her, knew she would never want to hurt another child, she told me she was afraid of doing it. That there was like just something that was reworked, and like literally we do have brain scans that like people's brains change when they're abused in this way as a child.
Yeah.
And there's just something that switches as far as their understanding and how they relate to others and how they see children, that it's what they know.
Yeah.
And like maybe you can think of it from a healthy perspective. Most people parent as their parents parented them. And most of the time that works out really great. And that, well, I wouldn't say most of the time. In that most people are generally healthy, functioning individuals, and you know, going by similar patterns to the way their parents works out pretty well. And it's kind of just like you do what you know, you do how you understand, and also it's not always like a sexual desire. Like it's not always that sexual, I want that feeling. It's not always that like attraction. A lot of times it's that power thing that we were talking about within rape. So with that, if you are someone who has that in your head as far as like, this is how you get power over someone, this is how you maybe give punishment, this is what I saw in my life and was done to me, you can maybe see. I mean, it is a very twisted way of thinking. It is really sad.
And they can't help that, right?
A lot of times, no.
brain.
A lot of times, no. Unless, again, they're doing a lot of work. Like, there are people who seek help and don't reoffend. Yeah, but it is definitely something challenging to wrap your head around. Of, you know, why someone who experienced that pain would want to inflict it on someone else.
So, I mean, if there's like a high recidivism rate and it's because of power, then like are most of these people like have like an issue with gaining power over others? Or like an issue with
I mean, it's not
aggression?
all others, that's the thing, it's definitely not all others, usually it's people that they're, like are the parent of, or are someone who's like near them. Well, now we're kind of talking about incest and rape, so
Yeah, I was just like,
for incest, what I was just saying, because that was the line I was on,
but
for
like,
rape, it is more of a power and control thing.
yeah, so like, if this is like, I guess, not like a personality type, but like it's like a pattern and it's abnormal and it's distressing, why isn't it apologized that someone who is like,
Well, they
a recurrent
likely
rapist-
they could meet, y'all, could you? Sorry. Thank you. So they likely could meet a personality disorder. They could, they likely could, depending on their, grouping of whatever personality characteristics it is, they could. But being a rapist is not.
Yeah, I just
one
meant
of
like the type of person
criteria.
who's like recurrently doing this and has like a flawed relationship with like, I don't know, like,
Right, so you could see them under psychopath, sociopath, narcissist. And then it's one of their behaviors. That's what I would say. As far as like if you were looking for a diagnosis for a rapist who comes through your door, you probably meet criteria for one of those. That's what I would say. Or even not, honestly, and just someone who maybe does this. Doesn't need
It's
to
so
meet
weird.
criteria.
it's like,
It is.
it seems like a lot of lesser things are pathologized, but like, this isn't.
Yeah.
It's like a pattern.
I don't, I totally hear that. I really do. And I think that's a really good critique. I do.
It feels like there's not a lot of like labels for like abuse offenders and like abuse victims.
Yeah, well, right, and I think that, is something that's coming out in the ICD-11 now, in that they're at least picking up more on trauma victims and as being a diagnosis. Because like oftentimes that like someone who comes in with trauma history is like meeting criteria for OCD, depression, anxiety,
Or like
social
PTSD.
anxiety, PTSD, they just have like a grab bag with many different disorders, they meet criteria for all of them. And then like the one common denominator is being a trauma victim. So the ICD is moving in that direction. It's the International Coding Diagnostic something.
And like, we don't have anything for that, we just have PTSD.
We just have PTSD. Yeah. So, yeah, definitely a critique of the DSM. And I do think something that the ICD is doing better than the DSM is. Yeah. Okay. Where was I? I think I was talking about recidivism. Did I hit all those things? Oh, okay. Well, recidivism rates decrease with age. I don't think I mentioned that. We mentioned here that, rapists, 60% are quite young, 25 years old, right? 25 years and younger. And then what we do see is as people get older, the rates of recidivism go lower. That's less likely for them to reoffend over time. So the treatments, I would say rocky, I guess, as far as the outcomes. Again, if they are not being court mandated to come, first question is, are they coming at all? I think. But then, let's say they are coming, so what are you gonna do with them? A lot of times, as we mentioned, the most empirically supported treatment is for CBT. So you want to try to modify that thinking, whether that's through the cognitions and social skills that you're trying to adjust and like helping them to see the twisted thinking. Maybe you could even talk about, especially with them, if they were someone who was abused as a child, thinking back, okay, if you were pained this way and you didn't deserve that, does this other person deserve that? Answer yes or no. So that could be involved in the treatment, and that could be very helpful. What we also see is, you try to modify that sexual arousal, whether that's introducing them to, more socially adaptive or pro-social sexual interests, or, potentially talking about those behaviors and how they can modify them in slight ways that they could still feel sexually aroused and that urge can be met in not an illegal way. What we also see is that there are medications to reduce sexual drive. This, I think, is probably works the best in the short term. However, again, if the person, is not mandated to take those drugs, are they going to want to? Is I think a big question, and the answer is probably a big no. But there are medications that are quite effective. What we also have is aversion therapy. So that actually is making someone averse. Like usually what we're thinking of is with CBT, that you're like slowly but surely showing a person a snake if they're afraid of snakes. Slowly but surely, moving them towards, a high, building if they're afraid of heights. Okay, so this is like the opposite effect. Like they're actually trying to create a fear and trying to make a sexual experience aversive. So that's pretty interesting, I think. There's also sensitization that you can do. So making it making them, how do I say this? Okay, so they are someone who right now is highly sensitive to these sexual urges. Like they are someone who gets very aroused, right? By a child, by inflicting pain on someone else, okay? They're very sensitive to that. Like that's something that they really want. So we want to make it that they don't want it as much, and that we want to make it that they don't need as much of it. Yes.
But also like,
I would say, yes, we definitely want to do that, but that would be more under cognitive restructuring, I think. How do I, is that I know, it's really hard to explain. Okay, so through talk therapy, talking to them about what they find to be sexually arousing, okay? And what they are sensitive to as far as what is arousing to them. And talking about it over and over and over and over, okay? That their brains get flooded by all this information about it, right? That they no longer have the same sensitivity. You feel me? Have you ever just said one word over and over again of puppy, 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 puppy? Have you ever played that game? And then it almost loses its meaning? It kills the buzz. That's a nice way of saying it. Kills the buzz. You no longer are thinking of oh, cute puppy. It's just puppy. It's because you've become flooded by it. You feel me? Beating a dead horse. That's a good way of saying it. That's what that is. Okay? So you're talking about it, going over it, but then also doing the aversive therapy with it, doing the cognitive restructuring that we're going to talk about it with it, that they get so flooded by it, it's not as exciting anymore. That makes sense to you? I feel like I've got a lot of blank faces today.
So it's the more that you talk about it with them and also having those two on the end, it'll eventually cancel out.
That's the hope.
Just wanted to make sure.
That's the hope. Yeah, that's the hope, Brian. Okay, so cognitive restructuring is kind of what you were getting at, Cyrus, as far as the impulse control. So you want to help them think about what they're doing. So you want to first, throw in some logic of this is bad. This hurts another person. in our world, we don't hurt other people. Now, let's slow down your thoughts, right? Let's slow down your behaviors. You have an impulse. Pause. Don't act on it. Let's talk about the impulse. Hopefully, you can then have this conversation with yourself when you're at home and you have this impulse. And then you can work yourself to do something else. That's cognitive structuring. And then social skills training is straight up what it sounds like. Like we mentioned, a lot of these people have some immaturity, are maybe very shy, a little introverted, socially awkward, I would say. And what's really helpful is just helping them be more mature in that way, helping them be more pro-social, helping them have, regular, normal friends, that they don't see themselves as maybe a deviant of society. And also this kind of helps with that cognitions of like, if they're not seeing themselves as deviant and as strange and as reclusive, you can say, okay, now you are able to make friends who are your own age, or you're able to make friends who appreciate you and you appreciate them. You don't need to be doing this behavior because you now can be with the rest of society. That's kind of the thinking with social skills. Yes, Adriana.
Cognitive restructuring is just
Is it teaching them right from wrong? Well, if it's someone who's a psychopath or a sociopath, is it teaching right from wrong? I wouldn't say that, but it's more helping them identify what the world sees as right and wrong, and helping them to identify that themselves so that they don't act on that behavior. It's more from the CBT model as far as what's the cognition that you're having. So what's the thought that pops into your head? I want to rape that woman. What's the behavior? They go do it, right? And what's the consequence? Consequence for them is, well, I may feel really good. I feel accomplished. I feel like, strong. For the woman, it's incredible pain and agony, right? So helping them identify those parts of the triangle, and then identifying like, okay, what's messed up about this cognition of like that initial thought of, I want to do this. Well, if you were able to talk to yourself and say, is this really what you want to do? Knowing that the consequence is creating a lot of pain, knowing that the consequence could be, you could be going to jail, knowing that the consequence could be that you're never going to have a stable relationship like you want to have, whatever it is, like talking to them like that. So it's not necessarily just like what's right from wrong. It's like a little more nuanced than that. Yeah, does that make sense? Yeah. Good question. Okay. All right. So more on treatment. So like I mentioned, there are those biological treatments, there are medications that can work. Antidepressants even can be one of them. But what also can work is castration. And that can be chemical or surgical. And chemical would be introducing hormones to individuals. And then surgical, you can imagine, is surgical. Yes, Adriana? Cut it off.
Oh.
Yep. But not the penis, the
Oh.
yeah. That's what it is. Yeah. Anyone watch Game of Thrones? The Unsullied? They're all castrated. What?
They're eunuchs, whatever they call them. Like,
The uniques?
they're eunuchs.
Yeah, that's like the.
That's like a
old
term
word
for
it.
people that.
Oh,
Yeah, for like someone who's castrated.
oh. Okay, there you go. Another word for it. I didn't know that one. Was that a Game of Thrones? Did I miss that?
No, I just know that from the Bible.
You know the-
Oh, okay, I was
bald
like,
dude?
That's not.
You know
Swear
the
they're
bald-
called the Unsullied.
the bald guy who's like super wise and like talks to those kids, like has the little birds or whatever.
Uh-huh.
He like at the very have you seen this season at all?
Yeah.
The first episode, he asked Tyrion why he makes eunuch jokes whenever he's offended by. The
Oh,
women.
you know, Cyrus doesn't want to ruin.
Oh, sorry. It's just a conversation. That's it. Nothing crazy.
Okay, sorry. All right. Thank you for for that explanation. And now everyone knows what being castrated is, so that's good. So yeah, biological or surgical, and we do see that it works really well. Doesn't get rid of though the thoughts, right? However, it can lessen them. We do find that a lot of times that testosterone can increase the intensity of the thoughts. So that is quite helpful. But usually you want to use it in combination with cognitive behavioral therapy, because probably they're incredibly distressed because they are, either in jail or something bad has happened, or they're experiencing distress because they are being castrated. So there's that, and then also just you want to help them with those thoughts. So they don't do that alone usually. Okay, now there's just totally really on the flip side, sexual dysfunction. So these are individuals who have impairment in seeking sexual gratification, as in like receiving sexual gratification or being able to achieve sexual gratification when they want to. And this, we do see among individuals who are straight, among individuals who are gay. There are many possible causes for the sexual dysfunction. So just thinking about what we know as far as sexual functioning when it's, working the way it should, when individuals, are two consenting adults. There's the desire phase. So that's when you, are thinking like, hey, this would be kind of nice. Wonder if this can go down later, honey. And then there's the excitement phase where there's some action, right? Where you're like working towards the orgasm. And then there's the orgasm, and then there's the resolution. There's the coming down. Things are done. And you're like, chill. So that is what happens when it works well. People can have dysfunction in any four of these areas of sexual response phases. And the dysfunction that they can be having can be behaviorally based or biologically based. So people can have little or no sex drive, and this can be because of medication that they're taking. This can be because they are maybe depressed, or maybe they're anxious, or just really stressed out. Or it can be something that's biologically going on with them. Maybe their hormone levels or testosterone levels may be off. Or it can be something more psychologically based. There can be erectile dysfunction, so the inability to achieve an erection. So this would create issues in excitement and orgasm. And that, as we know, there's medications for that as well that work pretty well. There's also early ejaculation disorder for people who ejaculate too quickly for their partner, to allow their partner to reach orgasm or have pleasure during their sexual experience. What? I didn't hear it, so that's good. And then there's finally delayed ejaculation disorder, which would create problems with orgasm and resolution. So that's someone who unfortunately can't reach that orgasm or has problems with the resolution as far as coming down. So we can have difficulties in any one of these four areas. What we actually see, this is interesting, early ejaculation is the most common male dysfunction in males under 60. Probably switches to erectile disorder after 60, because that just happens with age sometimes for men. Okay, so sexual, yes, Janet.
Also, I've heard like the sexual desire disorder comes upon people who are in menopause or entering menopause.
Yeah, definitely. Those hormone levels get shifted when their bodies are going through menopause, so that's very common. And what's helpful is, having hormone treatment, and that can be provided by any gynecologist. Yeah, Cyrus?
How long would successful treatment be like?
Hormone treatment for pedophilic disorder?
They're like talks specifically.
Talk
Is it used-
therapy?
Is like all the other stuff used in conjunction with like hormone usually, or is it?
Yes.
Okay.
Yeah.
What is like the time frame for that success? Probably.
You're never getting off those medications. You're probably never getting off those medications. You can try. Some people can be weaned off if it's a long enough time, and also as you age, those desires, just like even natural desires for sex, decrease with age. So that can happen for people. Like they kind of just get to an age they're not as sexually aroused as they used to be. But yeah, long-term therapy.
20 plus years.
Depending on how old the person is when they start, I would say. Like when they're hitting, 60, 70, you're probably getting into a safer range. So it kind of depends. But like if you find a person at 40s, yeah, probably they're gonna be needing those medications for quite some time.
They just decrease.
Yeah, and that's just a natural biological developmental thing that happens to our bodies. Yeah. Yes, but it's definitely long term. It is not like a short term, meet for 8 sessions, like years and years. Yeah. Okay, back to sexual dysfunction in women. So again, you can have difficulties with arousal. Similar to the reasons that men would have difficulties, as I mentioned, it could be psychological, it can be biological, as Janet mentioned. It can be, depression, anxiety, medication that you're on. Can be even birth control can affect sexual arousal. And then we have something that's called genitopelvic pain or penetration disorder. And this is for women who have pain when they are engaging in vaginal intercourse. And for some of those women, it can be that the vaginal hole, what is that called? I'm like, canal, thank you, does not open. It could be that they have tearing there. It could be also more psychologically based in that they have a fear that makes them tighten during that sexual period. And that is, incredibly, incredibly painful, but often penetration is not possible. Janet? Okay, disruption. So that can be treated as far as getting like they're not spacers, but like you can go to a sex therapist. Like there's some psychologists who focus on sex therapy, and they have different tools that you can insert into your vagina and slowly but surely create more space, and that people can work their way up to a if it's a penis or a dildo, whatever it is, that can be still pleasurable for that person, but it takes some work. But it is possible. And then also we have female orgasmic disorder, which is the difficulty reaching orgasm following the normal sexual excitement phase, so just not being able to reach that. That can also be biologically based and psychologically based. Can seek treatment for this as well, whether that's talk therapy because it's psychologically based, whether it's like a fear or an aversion or feeling like it's unholy or immodest, or there's so many different thoughts of why someone would feel uncomfortable reaching orgasm with their partner. And then also it can be biologically based as far as like if they're maybe experiencing pain, if they're not experiencing pleasure in the way that they like. There's many different things that sex therapists can work on with them. Any questions on any of those? Did I hit treatments for these? Mostly these are biologically based. I think I already talked about these, right? Okay, any questions? So this is the last slide. So, unresolved issues. How harmful is childhood sexual abuse? I think that's a dumb question, Pearson. Very harmful. Some researchers have questioned the conventional belief that is very harmful. I think it's just so dumb. Sorry. And findings, methodology, implications are controversial. That's for sure. So, alrighty. It's 10:17. Come back at 10:30, and we'll pick up with chapter 13. Yeah.
Did you put on the police last week?
I did the attendance orientation practice this weekend. Yeah, I haven't done it. It's just not there because I haven't entered it. Yeah,